The Virtual IV is a comprehensive and fully interactive simulator for training intravenous catheterization. Powerful 3D graphics provide visual realism, while a proprietary force feedback device accurately simulates the sense of touch for a truly immersive experience. Unprecedented depth with over 150 distinct case scenarios, each themed to in-hospital, pre-hospital, and military careers, and over 40 unique patient models that span human anatomy and physiology. Virtual patients respond with physiological reactions based on your interaction with virtual anatomy, pre-existing conditions, and the specific case scenario. Vein compromise, infiltration, bruising, and vein rolling are just some of the pathologies and obstacles you will encounter throughout learning. A host of other complications force the learner to respond appropriately while adding depth and realism to the learning experience. The procedure is performed with over 24 pieces of virtual equipment and additional procedural tasks appropriate to IV catheterization. Clinical accuracy is achieved with site-specific assessment, interaction, and response. Advanced debriefing and competency review structures record learner progress, provide instructor oversight, and allow users to focus on specific learning objectives. To ensure that the virtual IV is appropriate for your training needs, a host of instructor configurable options allow the system to be configured to local guidelines and protocols. Once logged in, select the career option assigned to you by your instructor. The Virtual IV Simulator will automatically configure case scenario content, configuration options, equipment, and imagery appropriate for the selected career. Navigate through the Virtual IV by clicking the navigation buttons at the lower right of the screen. The navigation bar allows you to advance to the next screen. Return to the previous screen. View screen-specific help. Log off, or return to the main menu. The Virtual IV contains 4 distinct training modules. Select Procedure Video to view a training video on intravenous catheterization. Select Anatomical Viewer to become familiar with relevant anatomy and vasculature. Select Practice Case Scenarios to perform the IV catheterization on a case scenario of your choice. Select Competency Training to progress through cognitive tests and cases of increasing difficulty while achieving increasing levels of competency. Review the case scenario and vital signs, then advance to site selection to select an appropriate insertion site. Choose the left or right arm and the specific insertion site, then advance to equipment selection. Hold the mouse cursor over items in the tray to see item descriptions. Choose the equipment you will need to perform the procedure, then advance to the simulation to begin the procedure. Throughout the procedure, you may review the case scenario, select more equipment, or choose a different insertion site. Zoom into the site by scrolling the mouse wheel. Rotate the site by simultaneously clicking the wheel and moving the mouse. Begin the procedure by selecting from the equipment you have chosen, or by selecting one of the procedure steps. Once a piece of equipment is selected, either apply it to the site or dispose of it in a trash receptacle. Perform the intravenous catheterization procedure by interacting with the virtual patient. the virtual equipment, the procedure steps, and the force feedback haptic device. Needle insertion, skin stretch, and palpation are performed with the haptic device. The haptic device icon will indicate when to interact with the haptic device to palpate or perform the needle insertion. Once you have completed the procedure, advance to the next screen to view a debriefing of your performance. You will see if you have successfully completed the procedure, a list of your critical and non-critical errors, and a list of cannulation events. Click on the movie icon next to an error or a cannulation event to view a descriptive training video. During competency training, your results are saved. You can view your competency training results by selecting Competency Review from the main menu. The Virtual IV also provides instructor functionality. Instructor features are accessed by logging in as administrator with the provided password. From the instructor main menu, you can review trainee competencies, create and manage user accounts, configure simulation and assessment parameters, calibrate the haptics device, and change the administrator password. If you are unfamiliar with intravenous catheterization, or if you desire to review correct catheterization technique, select Procedure Video from the main menu. View the educational catheterization video in its entirety, or select chapters to focus on specific problem areas. Select Anatomical Viewer to better understand anatomy and vasculature. While the 3D model of the arm loads, you will be able to choose between supinated and pronated arms and interact with the anatomy by selectively dissecting anatomical structures. Unselecting a structure causes it to fade, while selecting a structure causes it to reappear. Zoom into the arm by scrolling the mouse wheel. Rotate the arm by simultaneously clicking the wheel and moving the mouse. As you move your mouse over an anatomical structure, its name will appear, enabling rapid identification. Selecting practice case scenarios allows you to choose the level, care specialty, and the specific case to practice. A preview of the patient arm is shown for each case. Advance to the next screen to begin the procedure. Results from practice cases are not saved and will not appear in your competency review. Select competency training for a comprehensive training curriculum that will advance your skill level and maintain a record of your progress. Competency training provides an adaptive training system with level-sensitive assessment and remediation tailored to each user. As you progress through competency training, you will need to successfully complete cognitive and case scenario tests to advance to higher levels of competency. Whether you have selected competency training or a practice case, you will be presented with a case scenario. Once you have reviewed the case scenario, selected the appropriate site, and chosen the necessary equipment, you will be ready to perform the intravenous catheterization procedure. Before beginning the procedure, remove the needle from the haptic device and completely attach the catheter to the needle. Throughout the procedure, you can review the case scenario, select more equipment, or choose a different insertion site. Zoom into the site by scrolling the mouse wheel, or rotate the site by simultaneously clicking the wheel and moving the mouse. Perform the intravenous catheterization by interacting with the virtual arm, the virtual equipment, the force feedback device, and the procedure steps. Click on an item to select it from the toolbar. Only one item can be used at a time. Once a piece of equipment is selected, either apply it to the site or dispose of it in the appropriate receptacle. Certain items can be removed from the site by clicking on them. These include the IV catheter, constricting band, flush, lock, extension tubing, catheter hub, and IV tubing. Performing the procedure requires the haptic device. At the top of the haptic device is an area for palpation. This area is also used for vein occlusion. In the center of the haptic device is the needle insertion port. The needle must be inserted into this hole prior to the needle stick. At the bottom of the haptic device is the skin stretch area. Do not attempt to use a regular catheter. Use the catheter attached to the haptic device as you would a normal catheter. When placing the catheter onto the needle, make sure that the ridge in the needle is aligned with the groove of the catheter. To use an IV catheter, click on the catheter icon, select the length and gauge, and move the cursor to the site. Click to locate the insertion point. The bevel orientation will be displayed in a circular inset. To choose a new insertion point, click on the site while the needle is outside the skin. Once an insertion site is chosen, an icon will appear to indicate that the needle should be inserted into the haptic device. Before performing the needle stick, it is necessary to engage the haptic device. Insert the needle into the insertion port until the needle on the screen illuminates and you hear the engaged sound. After the device is engaged, proceed with vein cannulation as though using an actual catheter. To palpate a location on the site, click on the palpation icon. Move the palpation fingers to the desired location on the arm and click. Once a palpation location is chosen, an icon will appear to indicate that you should palpate in the palpation area of the haptic device. Click elsewhere on the site to choose a new palpation location, or click on the palpation icon to turn palpation off. To apply gloves or goggles, click on the gloves or goggles icon. To remove, click on the corresponding icon on the lower left side of the screen. To use a cleansing wipe, saline wipe, or povidone iodine swab, click on the corresponding icon, move the item to the site, then click, hold, and move the mouse. To apply the lock and syringe flush, or extension tubing and syringe flush, click on the corresponding icon, then click to apply. The syringe will flush automatically. For additional help during the procedure, guiding messages appear at the bottom of the screen. For a more detailed description of the equipment, click the question mark icon in the navigation bar. Once you have completed the procedure, advance to the debriefing screen. The debriefing screen provides immediate feedback on the procedure you just performed. The debriefing screen presents a performance overview with your overall rating, the amount of time it took to complete the procedure, the amount of time the constricting band was applied, and whether you were successful in completing the procedure. Specific feedback is divided into cannulation events, critical points, and non-critical points. Critical points are required for a successful procedure, while non-critical points reflect the quality of the procedure. Click on the movie icon corresponding to an error to view a training video specific to that error. Click on a cannulation event movie icon to view a subcutaneous animation of what occurred during your cannulation attempts. After analyzing your performance, you may advance to the next screen or return to the main menu. When you complete a case scenario or cognitive test during competency training, Virtual IV stores the results. Access this information by selecting Competency Review from the main menu. Your username and current level appear at the top of the screen. Select the number of cases for review, then review your competencies by average score at each level, by specific skill scores, or by learning progress curve. The specific skill scores allow you to focus on specific problem areas, while the progress graph shows your learning progress. Sort your past case scenario debriefings and cognitive test results by clicking on the column headings, then click on a title to view results for a specific case. The Virtual IV Simulator provides a total training solution for intravenous catheterization, both for the student and instructor. We hope that this introduction has adequately familiarized you with the Virtual IV training system. For additional information, you can access the help pages on each screen, as well as following the guiding messages that appear at the bottom of many screens. Additionally, a user manual is provided with more detailed information. Laerdal hopes you find the Virtual IV a valuable resource for your ongoing training needs.